In first module, we have learned the stroke by definition and its type. We welcome you all in second module of Uniforeva Eskool for stroke. In this module, we will see stroke by warning sign, cause and various diagnostic tool and its prevention, which include various reduction in the risk factor. My name is Prabhakar Jha and I am from sales training team of Unichem Laboratories Limited. As we have understood the stroke by its definition and its type, now we will see what the warning sign of stroke are. These warning signs in first seen on the patient face as this drop on the one side and its affect patient arms, weakness in one arms or leg, and sudden difficulty in speech may also experienced by some of the patient. Other warning signs are blur vision, dizziness, and most important, patient will also experience difficulty in swallowing. Severe headache is also one of the warning sign of stroke. Now we have understood what are the warning signs. Let's check what are the causes of stroke, as these warning signs are caused by few major lifestyle habits. Major cause of stroke are smoking, high cholesterol level in the blood, high level of LDL, HDL is low, and when your TG level is high, that's called high cholesterol level in the blood. High blood pressure or patient is labeled as a hypertensive patient. Patient also taking excessively alcohol. Lack of exercise or lack of physical activity also increase the risk of stroke. And last but not the least, increasing age are the one of the main cause of stroke. As we see the causes, now we can see the diagnostic of stroke that consists majorly the computerized sonography, that's we called CT scan of a brain, then MRI, that is magnetic resonance imaging of a brain. Most important, carotid ultrasound and carotid Doppler are other important tests conducted by doctor to see the level of stroke. Doctor also recommend some blood test. Doctor will also check the physical appearance of the patient, and cerebral angiogram and ECG are the other diagnostic tools available for doctor to diagnose stroke. Let us move, and after diagnostic, let us see what is the different preventive measure required to control stroke and its effects. First, patient required to reduce its salt intake, cut down the excessive salt intake what he take in the food and normally. Patient should immediately stop all type of alcohol intake. Patient need to take healthy diet like vegetable and fruits should be included in his daily routine of diet. Stress level need to be reduced. Physical activity need to be started, and smoking need to be stopped, and regular checkup on the weight. So patient need to maintain a healthy weight, and the treatment should continue for any of the condition. If patient is suffering from high cholesterol or high blood pressure, patient should not avoid or miss any dose of his hypertension and cholesterol medication. Most important, to have proper control and prevention of stroke, patient should have regular checkup for risk factors. In this chart, you see the three category of patient, and we need to understand this chart before we are conducting any stroke detection camp. It is also important for us to understand this chart. It is a stroke risk scorecard. You have to give the score of each risk factor, and is this scorecard, one tick is equal to 1 marks. As per patient feedback, we need to fill the form and check the category. If any patient score more than 3 marks in high risk category, so the first and foremost need of this patient is to reduce the risk factor and come into the moderate or the caution state, and then patient should aim to come in the low risk category. And the same applicable if any patient score more than 4 and between 6 in caution category. The first and foremost requirement of this patient is to come down and reduce the risk factor and be in the low risk category. If any patient fall into the low risk category, they patient need to follow the same lifestyle, dietary, and even patient is advised with any kind of hypertension and cholesterol medication, they should continue the medication. Now we have learned and understood the more about stroke by its warning sign, causes and prevention. Now it's time to revise all of these. If any warning sign seen in the patient, you need to act fast and check for sign on his face, arm, speech, and moreover try to reach hospital as early as possible. So remember friend, act fast is the core message if any patient is seen with the warning sign of stroke. Causes of stroke are mainly the high smoking intake, high level of cholesterol in the blood, hypertension or high blood pressure, excessive alcohol intake, lack of exercise, and more importantly, the growing age or increasing age are the causative factor for stroke. The major diagnostic tests are CT scan, MRI, and all type of carotid artery imaging. Patient will also undergo ECG and few blood tests. Prevention also include minimizing all the risk factor like maintaining a healthy weight, reducing the alcohol intake, even the cut down the smoking and alcohol intake, and patient should also consider or minimize his risk factor like diet, controlling the high blood pressure and high cholesterol, and moreover diabetes by regular medication and lifestyle modification. Happy selling and learning. We will meet soon in the next module. Thank you.